Dear viewers, welcome you all to our show, Orthopaedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other, and definitely by getting vaccine. And I am a proud Bangladeshi who has got his vaccine due to our Honorable Prime Minister, Sheikh Hasina. I just give a salute to our Honorable Prime Minister for arranging vaccine for all Bangladeshi people. Dear viewers, today our topic is the complications in Ilizarov, that is the challenges in Ilizarov surgery, as well as a live virtual tour of Kurgan Ilizarov Center, that is the mother of Ilizarov Center. And today our speaker is Professor Novikov sir, a very renowned scientist and Ilizarov surgeon from Russian Institute of Ilizarov Surgery. So I would like to request Professor Novikov sir to join with our Orthopaedic Solution Academy. So good afternoon and welcome to our show.
Good afternoon, colleagues. And let me start with the interesting topic.
Sir, just a few minutes, sir. Just a few seconds. Now, I would like to request our honorable academic expert, Professor M Bari, sir, a very renowned and legendary Ilizarov surgeon in Bangladesh, Professor M Bari, sir. Sir, welcome.
Good afternoon,
very much.
Good afternoon.
Thank you. Good afternoon. Thank you, Tanvir and Novikov. Okay.
Dear viewers, the complications, that means the challenges in Ilizarov surgery. We all faces complications and challenges, and we have to overcome it. But how? If you know the problems, then you can overcome it. So please stay with us and stay with Professor Novikov sir, so that you can face the complications, you can know the complications, and you can overcome it. I'm Dr. Tanvir Ashraf, consultant orthopedics, working as a moderator in Orthopaedic Solution Academy. And now I would like to request Professor Novikov sir to start his presentation, the complications in Ilizarov. Professor Novikov sir, would you please start your presentation, sir?
Thank you very much, dear Chairman. Good afternoon, all of colleagues. And let me start from just a moment. From Ilizarov. This year we celebrate 100 years since his birth, 70 years of Ilizarov methods and 50 years of Kurgan Ilizarov Center. We have airport with name of Ilizarov. Our center has name of Ilizarov. Some planet has name of Ilizarov. And like any methods of treatment, Ilizarov methods is accompanied by errors and complications. And when we talk about apparatus of Ilizarov, we all time think this is method of Ilizarov. And when we talk sometimes about methods of Ilizarov, we think this is apparatus of Ilizarov. But you can see this is absolutely different external fixator. This is on the left side, this is not Ilizarov frame, and on the right side, same, not Ilizarov frame, but maybe doctor treat this patient with Ilizarov methods. And when we ask anybody about risky of Ilizarov methods, how we can answer? All of orthopedics says, oh, very high risky, because and in the literature, we have big difference between incidence varies from small percentage till more than 200 percentage. For example, Jack Caton calculate everything, which each problem, each difficulties, and so many complications during the treatment doctor, orthopedic surgeon see, And usually this is why? Because we use Ilizarov frame of variety of conditions. In Bangladesh, in Russia, in Mexico, in China, and no consensus or clear-cut criteria as to what constitutes and complications. And big rates may range from 2% and more than 200. So many complications at present time offer it using the methods of external fixation device. These classifications I took from Indian doctor, and he divided like local, systematic, immediate, early, late. This is classifications I took from our cathedra, from our center, from Professor Soldatov. This is like general classifications, and he explained about pin track infection, post-operative, neuropathia, like post-operative consolidation of osteotomy, virus cutting, acquiescence deformity. I not understand these classifications. For example, technical errors, preoperative and intraoperative complications. This is I understand. Intraoperative, preoperative complications. Again, this is classifications from our center. Complications of non-infections and infections from the side of the bone, from the side of the soft tissue, little bit difficult for understanding. And again, classifications, tactical mistakes from Professor Soldatov, wrong choice of number and level of osteotomies, errors in the calculations of deformity, disregarded of disease etiology on patients, not so good for understanding. If we will take classifications of Savkot, Jacques Caton, all events in osteosynthesis, Jacques Caton is initially considered as complications and divides them into categories. Good classifications from Drorpel: problems, obstacles, and then complications. Currently, there is no ideal classifications of complications. And we offer from our side, from our team, we consider only those events that negatively affected the final result of treatment to be a complications. And during the treatment, we meet with so many errors, with so many difficulties and mistakes. And what is it? Error. Wrongness in actions, deeds, judgments, those. What is impossible to calculate and predict in advance based on accumulated knowledge. And we offer complications not related to osteosynthesis, like general surgical complications, and complications related of osteosynthesis. And we add one point more: objective and subjective factors in errors and complications. Errors and complications related with osteosynthesis, we offer mistake and complications by time of occurrence. You know what is it? Before surgery, after surgery, during the correction or lengthening, during the consolidation, after the removal of frame. Errors and complications in the interest of organs and system. For example, skin pin track infection, or contracture of joints, or deformity of bone. Another point, errors and complications, severity of clinical manifestations. Because sometimes we have only red skin when start irritation of first step of infection of virus. Then second, some pus discharge, then coming osteomyelitis. If doctor not prevent these difficulties. What is it objective? This is not depending on the doctor and the degree of his professional qualifications. Subjective, depending on the knowledge and skills of the doctor and his experience. And you see, when objective and subjective meet, we have on the center factor of risk. For example, objective, broken some wires or broken some details of apparatus, very seldom, but possible. And doctor not very good check. On the after that will come in some situation. This is I call like factor of risk. Another influence when we accept the wrong patients and insufficient knowledge of the patients about the apparatus and methods. Treatment will very difficult on the end. Another big factor of risk when meet subjective factor of the doctor and subjective factor on the patients. And I suggest on the final result must be very, very important, how I can say, not only doctor make a result and patients too. And another interesting situation when any problem come, immediately come another problem. I call this principle domino. And remember this picture. You can stop this negative reaction if you will do something. If you will, without activities, complications will invite another complications. For example of principle domino. Doctor selection wrong patients, fat patients, and not good communications with patient. Doctor improper insertion of wires, only 2 wires on the level of ring. Then coming fracture on the level of wire insertion, like knife. Reosteosynthesis, all of these points, subjective factor of doctor. This is all complications come not from methods or from apparatus, from device. This is fault of doctor. In other situation, you can see insufficient number of pins, non-stable fixation, wrong choice of rings and part of the apparatus. When frame touch skin, and when come small problem with pin track, not enough care, on the final come osteomyelitis. All of these mistakes in the hand of doctor, not from apparatus. Another principle domino, fracture of tibia, distal part of tibia. Ankle joint, doctor try treat this situation with plaster cast, not satisfied with the result and put on external fixator. I cannot say this is Ilizarov methods. This is external fixator, nothing more. And you see, where level of hinge, level of deformity and level of hinge. And now we have big dislocation. Doctor check with this is white rope and satisfied because all of joints, hip joint, knee joint, and ankle joint on the one line. Mat is perfect, but on the X-ray we can see small, big dislocation, and this is final result. Another point. So many dislocations and level of hinge, and you can see condition of soft tissue. Everything mistakes with frame. This is come from doctor, subjective factor of doctor. Condition of skin. This is fault of patients because many months patients not come for checkup. Why? Must ask patient. But this is not fault of doctor. This is mistake of patients. In other patients, and you can see severe deformity in the proximal part of tibia during the lengthening. Why doctor continued of lengthening? This is final result. This is deformity come not on this X-ray. This deformity come 2 months ago. Why doctor not prevent this deformity? And you can see here on the proximal part we haven't any hinge. How he won't correct this problem? From beginning, you see big scars. What is it? Big scars. This information for doctor and skin show I cannot continue with lengthening. Please stop. But doctor continued. Not proper tension pins and not so stable this external fixator. And during this treatment, doctor calculate only amount of lengthening, centimeters, but where functional and X-rays results. This is final result. Severe valgus deformity, severe equinus deformity, anticurvation deformity. Final result. Condition of skin. Why not clean? Yeah. Pin track problem. I cannot say this is infections, but this is not depend of Ilizarov frame. This is mistake of doctor and patient. Patient not go to the gym. Patient not contact with physiotherapist. Doctor not give instruction. Patient during the treatment first time stand up. All period of treatment lay in the bed. This is not methods of Ilizarov. This is only external fixator, nothing more. And very important, on noticing that treatment is not going fine, we should ask for help from experienced doctor. If you have some problem, please call Dr. Bari. And I want to repeat again, what is it our methods? Almost bloodless surgery, firm fixation of bone fragments, early weight bearing of the affected limb, function of the adjacent joint, postoperative adjustment of the bone fragments from the time of surgery till the removal on the frame. And I add 1 point more. Most important, good rapport and understanding between the doctor and the patients. This is patients from India, from Bangalore. 1 year patient stay at home and patient satisfied, near 10 centimeters amount of lengthening, high increase, and you can see ballerina foot, which mistakes, you can see condition of soft tissue. Patient during this year never stand up, never walk, all time spent in the bed. this is not a good result. This is bad result for me. And this is fault both of doctor and patients. And we cannot calculate only centimeters, because for me, better 2-3 centimeters and excellent functions of joint than 10 centimeters and lost mobilities. Non-compliance with Ilizarov principles is already mistakes, which inevitably leads to complications. And first, do not harm. This is pretty girl want increase height only for 3 centimeters. Very easy procedure, very quickly procedure, but not understand doctor and not follow his instruction. And on the end, he was more shorter than before treatment. She has valgus deformity. She has luxations both of feet. She has osteomyelitis. She has broken on level of the wires. Big scars. This is baby lost life. Only 3 centimeters lengthening. And I think this is not a message of Ilizarov. This is big fault of doctor. This is my patient from Australia. This is my big fault. Patients more than happy because 13 centimeters lengthening increase height, but you see, colleagues, you can see big disproportional. This is situation not give improvement on his life. After this patient, I changed my mind. And just now, I never follow crazy idea of patients, maximum lengthening. We need only remove disproportional. On start of treatment, he has very long upper extremities and very small shortening, disproportional shortening of femur and tibia, maybe 2-3 centimeters both. Totally, I need lengthening maybe 5-6 centimeters maximum. But I follow interest of patient and bifocal lengthening finished with 13 centimeters. And just now, this is patient very difficult go up and down by stairs, very difficult stand up from chairs, very difficult drive because very long tibia and very short femur. And our patients during the treatment each day, twice go to the gym, activities. Now this is Epoca de Ilizarov patients in our hall, Congress hall, in front of Ilizarov, 12 centimeters lengthening, use only sticks. And each day this patient stand up, walk, make exercise. And I won't repeat again. You see, many times, methods of Ilizarov, this is not same than apparatus of Ilizarov. And apparatus not same than methods. And excellent if apparatus is methods of Ilizarov. Oof, this is perfect. And Ilizarov methods allow the doctor to correct the error and prevent complications. For example, pin track infections, remove and forget. Broken wire, remove and forgot. If plates, remove. If nail, intramedullary nail broken. If plates, infections, or intramedullary nail infections, what will be? And all of problems, all of difficulties, this is information for me. For example, you see, soft tissue infections. When we start treatment, we have infections. But on the end, I cannot say this is complications and this situation negatively influence of the final result. Or neuropathy. one patient. Doctor give care, and all of this neuropathy disappear, and then we cannot remember right side or left side. I cannot calculate. This is complications. So many equinus deformity during the lengthening. Each patient has this problem, but this is information for me, like doctor. I need degrees speed lengthening. Maybe I need change my plan and not to do big amount of lengthening, not 12, not 10, maybe better 8 or 6 centimeters without equinus deformity. And on the end, only one patient from 36 to 1. One patient has complications from 36. And very, very important, colleagues, all errors are subjective. All errors. Not all errors lead to complications. Very small amount go to the complications. If doctor not so intelligent. Errors are the precursors of complications. And very important, the error is reversible. And the complications has consequence. And on the end, all negative situations during the osteosynthesis are subjective, colleagues. What I mean? You can remove all negative situation from treatment. And you see, this is genius, Antonio Stradivari. He created magic violin, but without magic hand of Nicola Paganini, this is only piece of wood, nothing more. Everything is your hand. If you will study, if you will teach, if you will hear, this is fantastic music, orthopedics music. Another genius, Professor Ilizarov, Gavril Abramovich, beyond excellent magic baby. And without hand of surgeon, this is only piece of metal. No one, even with the most eminent in any profession and specialty, is not free from errors, mistakes, and judgments. Not that person is smart who does not make mistakes. There are no such people, and his cannot be. That person is intelligent, who makes mistakes and who know how to easily and quickly correct them. This is, says Lenin, many, many years ago, and nothing changed more. And this slide I am already shown from heart of one Islamic surgeon from Tehran, who many years worked like classical orthopedics, and now many years work like our brother, like Ilizarov surgeon. I want again congratulate all of us with 100 years of Ilizarov birth. And I want to invite you for cooperation and exchange of our experience. Thank you very much for your attention.
Thank you, sir. Thank you very much for your nice and excellent presentation. There is the complications in Ilizarov. Sir, would you please show us some photograph of Kurgan Center, that is the mother of Ilizarov?
Yeah, without rest immediately, yeah?
Yes, sir. As we disconnect Professor Novikov, sir, we are waiting for reconnecting with Professor Novikov, sir. During this moment, I'm with Professor M Bari, sir. Now, I would like to request Professor M Bari, sir, to tell something about the complications that we face in Bangladesh in a real life experience. Sir, would you say something about the complications that you are facing in your experienced life or in your lifetime achievement in Ilizarov part?
So thank you, Tanvir. Can you hear me?
Yes, sir. We can hear you loudly and clearly.
Okay. I must say that Professor Novikov is nicely mentioned and showed everything regarding the complications. Before doing Ilizarov surgery, one any orthopedic surgeon should know the basic of Ilizarov. Basic of Ilizarov. Whenever you have earned the basic of Ilizarov, then you go for the advanced Ilizarov surgery. By Ilizarov surgery, we are treating any trauma, any deformities that may be congenital and acquired. And at the same time, if you or I myself, if you go for any complications, if we violate the Russian original principle, then you may invite the complications. And complications from the doctor's side, most of the time it comes from the doctor's side. Before starting the Ilizarov surgery, to avoid complication, you must counsel your patient first. Counsel your patient first. Patient's relative, and you must tell everything what you are doing and what you will achieve by this technique. As for example, I'm telling you, we are treating as for example very common thing non-union of the any long bones. And at the same time, if you don't follow the meticulous, follow the principles and follow the patient regularly, you may invite the non-union. Rather getting treatment of non-union, you are inviting again non-union, not treating the non-union. You're not achieving any union if you violate the principle. See, he has shown the one case from India. Have you seen that one? If you go for lengthening 2-3 centimeter, you have lengthened. At the same time, if you don't see the principles and don't look up to the near the joint and the wires are stable or not, your mechanical stability is good or not, your wires are loose or not, you are doing proper dressing or not, you don't check your apparatus every day. I told you in one of my lecture that Ilizarov apparatus is just like aeroplane. This is just like aeroplane. Every day you must tell your patient, you must check your all nuts and bolts and wires every day. If it loosens, there will be painful condition. Why Ilizarov patient complains pain? Because the wires becomes loose or something wrong with the wires. As for example, Professor Novikov told, whenever you're plating, you're doing plating or interlocking nails, your interlocking nails is broken, you must remove. Plate, inviting infection, you must remove the plates. No other antibiotic will help you. Same case with the Ilizarov apparatus. Your wire is loose, you must retension the wire, or if it invites pin track little bit infection, you remove the wire, put another wire. These are the basic principles of the Ilizarov technique. And I told you that in Kurgan Center, original Ilizarov, message of Ilizarov is transosseous. The technique is called transosseous osteosynthesis, through bones. When you are using the pins, you are not going through. Only biocompatible thin wires you're using and giving stability. These are the main things. Principles you must follow. Thank you very much.
Thank you, sir. Thank you very much, sir. You just told us that if there is any pin track infection in case of Ilizarov, then we have to remove that pin immediately and put another pin. In that case, is there any difficulties to maintain the same position in the same track? Is there any difficulties to do that things?
No, you can change the track. You just remove your wire, Ilizarov wire, not pins, wires. You just remove and then put nearby the another wire. And striving force around the ring must be equal. Stability is the main thing. When your wire is totally stable, which is coincides with the principles of the bones, isoelastic, hydrostatic, pneumatic. This is the properties of the bone. Your wire is also like elastic. You know, original Ilizarov wire is very much elastic, which coincide with the properties of the bone. So that's why only thin biocompatible 1.5, 1.8 or 2 mm wire you can use. Pins, that means shunts, when you are using, that is very big, 5.5, 5.6 or 6.5 or 6. You are making a big hole, and that gives only rigidity, not flexibility. With Ilizarov wire, you are giving flexibility. Flexibility. That's why main principle of Ilizarov methodology, when you apply the apparatus, you ask your patient to go for load and motion. Then it gives flexibility. When you are repeating only the shunts, lots of Western doctors, they are using shunts. That gives rigidity. That is not original Ilizarov. That is not the message from the Ilizarov that told Professor Novikov. Okay.
Yes, sir. Thank you. Thank you very much, sir. Sir, what about the pin track infection that already starts so that we remove the pin? Do you need any special care for that pin track infection
You
of
know,
that Elizabeth wire?
yes, pin track infection, how it occurs? When your pin is loose or you are keeping your pin for 2, 3, or 4 months, it becomes loose. That's why you must check every day. Whenever you see from through the pins coming something yellowish, just fluid, or you are making a small hole there, you remove that one. Remove that one. You tell before doing surgery, you must tell your patient all the time. It may happen. That's why whenever patient comes to my place, I give him the instruction book which is written in Bengali so that the illiterate patient can also read that one. Illiterate means 5, 6, 7, 8 who can read only Bengali. He reads. I always check. Have you written? Have you read this one? Patient is yes, sir. So what the instructions written there, they can follow. They can follow. Before surgery, you must tell your patient, this may happen, this may happen, this may happen. But if you properly apply Ilizarov, fantastic result, I tell you. The main problem is that our orthopedic surgeons, after applying Ilizarov, they don't check. They don't do any proper dressing. Whenever you do proper dressing and tell your patient to cover Ilizarov frame, you can give him the just cover. I am giving the cover, and at the same time, I'm giving the patients one spanner and one box range so that he can check. You must show the patient how to check the apparatus every day. If your frame is stable, you can put 100% white beer. And even you have seen the Novikov has shown how they are doing exercises, rehabilitation center. They very big rehabilitation center in Kurgan. They are doing exercises all the time with this series of apparatus with a stable fixation. Fundamental principle is a stable fixation, just like an aeroplane. Otherwise, you will face problem. Patient will face problem. Doctor will face problem. And regarding the complication, sometimes you are also responsible for making these complications. If you don't check, if you don't properly advise the patient, then complication may arise. A pin drug, this is not a very important issue, not a very important complications. Sometimes proper dressing with a spirit, and sometimes you may advise antibiotic. It helps. If it doesn't help, proper is loose, you remove that one and put another one, and solution will be there. Okay, thank you.
Thank you.
What is
Thank you very
Noviko?
much, sir. Yes, sir. I think he is disconnected and is trying to connect with us. During this moment, we are gathering some knowledge from you, sir, as because of you are the legendary reserve surgeon in our country. So I don't want to miss this time also. So I want to ask you another question that is regarding the osteotomy. Sometimes with the young surgeons do, the osteotomy, and that is not complete. But we cannot check at that moment. But after 5 or 6 days or 10 days, when we try to start the distract the bone, then we can't. And then we do a X-ray, and then we see what is happening there. There is incomplete osteotomy we have done there. But after 10 or 12 days, we found that things. What can be done in that case if we do incomplete osteotomy and we found that after 10 days or 12 days?
Then re-corticotomy, re-osteotomy, or you can loosen the bar. As for example, you have done the corticotomy in between the first and second ring, and your 4 bars are there, connecting rods, that is bars. You just remove your bar, loosen the bar, and if you have C-arm, you can see in the C-arm, and just you rotate. You tell your first assistant hold the proximal ring, and second ring you just rotate laterally. If you see there is no movement, and in the cortical side, you can feel with your finger that that one is moving or not. If you don't have C-arm, even you can rotate, you can easily understand that there is something happening in between the 2 bones. If you see that you are not, your corticotomy is quite incomplete, then you can go for recorticotomy in the same side also. It will help you to do the corticotomy in proper way. Okay, you understand?
Sir, is there? Yes, sir. Yes, sir. Thank you, sir. Thank you very much for giving us instruction. Sir, is there any time bar that we can do recorticotomy after 10 days or after 12 days, or we can do it anytime when you found that things?
Anytime you can do, no problem. Yeah, as for example, for adult, you can go for distraction 4, 5, or 6 days. Okay, for children,
Yes, sir.
today you have done the corticotomy, you can start from tomorrow, or you can start from day after tomorrow. If you do delay 4 or 5 days in children, the bone will unite because pediatric periosteum is very thick, and again, very easily it reunites. So that's why for children, second and third day, for adult, fourth or fourth, 5 and 6. 7 days too long. I don't use. On an average, I go for 5 days, maximum 6 days. You go distraction. After 10 days, you see in the check X-ray if your distraction is hampering, you are not getting distraction, then you could go for corticotomy again. Take the patient to the OT, just a gentle hit in the corticotomy side, it will break. No harm. Then again you wait for 3 or 4 days, 5 days, then you could go for distraction. These are
Thank you
the
very much,
things.
sir.
These are the
Yes, sir.
things that you should have to follow.
These are very, very important things for us, definitely, sir. So sometimes we do some mistakes, so that after Ilizarov operations of tibia, we found that there is a common peroneal nerve injury, or we found that there is a drop foot there in the first post-operative day. Then what should we do, sir? We should observe the patient, or we should remove the wires from the proximal part of the tibia.
Before surgery, if you see the patient has got the foot drop before surgery, then you should have to think about that one. There's something wrong with the common peroneal nerve of the patient got injury before or after the result of surgery. If you see there is a foot drop, then you continue your process. Later on, when your healing process is finished, then you can go for TPT. No problem, you can do that. And by this time, you must tell your patient that you have this problem. You must frankly tell to the patient you have this problem. Don't hide the problems. You must share your complications during surgery or after surgery. You tell your patient, and I'll try my best to overcome you these complications. It is better to tell the patient. Foot drop you can correct, no problem. After TPT, bone is healing, then you tibialis posterior transfer, you do it, no problem.
So it is just due to the Ilizarov wire fixation. If the foot is okay and the common peroneal nerve is okay before the surgery, and after the surgery we found that in the first post-operative day that there is a foot drop, then what should we do? We should remove
So
the
you do
wires
your
or
exercise,
leave it
it
alone.
tell you, no, don't remove. We will think that this is not for the wire. But sometimes I have not seen like that, that during surgery you have touched the common peroneal nerve or you injured the common peroneal nerve. I have not seen. Head of the fibula, don't go to the just common peroneal nerve, just below the neck of the fibula, and it goes posteriorly. So that's why you just put your first wire through the head of the fibula. Head of the fibula. You touch head of the fibula, you can easily touch, and by this you can put your wire, introduce your wire. Okay.
Thank you, sir. Thank you very much for giving us lots of information that we gather from your long experience. Sir, would you please try to connect with Navikov, sir? Would you
Let me
please
let
give
me.
him a call?
Oh, interesting. Very interesting. Novikov, he has lost. Hello? ওই তোমার উচিত ছিল তখন ওই কন্টিনিউ করলে সে পারতো, কন্টিনিউ স্টাফ ইন্টারাকশন হয়ে যাও, তুমি তো কাট অফ হয়ে গেছে। আমি দেখি এখন সে দুইটাই ধরে না, ভাইবারে দিচ্ছি, হোয়াটসঅ্যাপে দিচ্ছি, আমার মনে হয় লাইন নাই, কিন্তু ক্লিয়ার হচ্ছে
Maybe
তোমার।
yes, sir.
তো
Maybe he
হওয়ার
is
কথা না।
disconnected, sir. Now, we gave trials, sir, before starting our live program. We gave
ও
trials.
ফোন দিছে, ও ফোন দিছে, দেখি।
Dear viewers, we're trying to reconnect with our honorable speaker, Professor Navikov, sir. I think there is some network problem as because of it's a long distance. It's from Kurgan, Russia, so there may have some connectivity problem there. I think the complications and challenges of Ilizarov is very minimum than the other operations. That's because of Ilizarov is there to overcome the complications and to overcome the challenges that we face in other operations. So, as our honorable speaker and academic expert tell us that definitely we should care about our apparatus. That means we should fix our wires properly. We should take care of our rings, connecting rods and wires, and we should take care of our pin track. And definitely, we can advise our patient to make a cover to cover his Elizarov. That is the whole apparatus. So it can prevent him from the outside dust, and it can help him to live a better life. And I think this will be very important thing for all of us.
Yes.
We got Professor Ravikant sir again. Thank you, sir. Thank you, sir, for joining with us again. And I think this time the network will be better for us. Professor Ravikant sir, we are eagerly waiting for the uh, photos of Kurgan Center.
Yes.
Very sorry, I am already started and finished. Because
Oh, he has
very
started.
sorry.
No, we have not seen anything.
I won't repeat again. And
Yes, sir. Sir, again became disconnected. I think so, sir.
হ্যাঁ
А куда мне нужен?
না না আসছে সে অলরেডি বক্তৃতা করে ফেলছে ওরে শেষ করে বলে আমি তো তুমি দেখো না now he's trying again.
Just now you can see?
Yes, sir, we can see you, but we can't see the slides, sir.
Yes, we can see you, but no slide. Try this. Yes.
Now I can start?
Yes.
Very, very sorry. Not so good communications with. I think this is our weather. Because yesterday we have severe wind and minus more than 30. Dear colleagues, I want again say about our father, genius.
Там еще где-то когда заканчивается?
Через час.
Через час?
Кто-то поступил?
Ну, там Сырчиков, Миколенко, кого-нибудь.
Хорошо.
Кого-то Олег, кого-то это. Они обе, Наталья Геннадьевна.
Ilizarov Center today, this is Federal State Budget Institution, Russian Ilizarov Scientific Center, Restorative Traumatology and Orthopaedics of Ministry and Healthcare in the Russian Federation. World-known founder Gavril Abramovich Ilizarov, almost 50 years long story. 100 or 1,500 of highly qualified staff. System certification ISO 2008 and 2015, International Department for Supporting of Foreign Patient. Ilizarov Center has clinic, researcher, and education. Clinic has over 30,000 surgeries per year, hospital capacity of 500 beds, 21 specialized orthopedics department, unit clinic for patients with bone infections, our 250 consultations daily in outpatient department. Research, this is basic science, experimental studies, multi-central researcher studies, 30 scientific researchers and clinic laboratories. The Ilizarov Journal of Clinical and Experimental Orthopedics, Jenny Orthopedy. Education means Ilizarov Fellowship International Program, our Spine Educational Center, Cerebral Palsy Reference Center, and Asami Russian Training Center. And Ilizarov allows age continuity, patient from 0 to 100, technology continuity. And the Ilizarov method is a safe bet in traumatology and orthopedics when another techniques fail. And sorry, Dr. Bari, I cannot find flag of your country, but I promise I will put. I invite you in corridor of our center. We have interesting, funny but interesting building. This is gym where twice daily patients from any department come for exercise, and without exercise we cannot continue our procedure, any procedure, lengthening, correction, without exercise, without weight bearing, our operation nothing. And there we need experienced staff who very good help and teach our patients. And you can see after surgery, I think this is 5, 6, maybe more centimeters lengthening, and patient can everything with this hand or with this leg without any support, baby walks. And I cannot say this is heavy treatment. like usually sometimes another doctor says. And without doctor, patient cannot get result, and without patient, we cannot get result. When we have here Ilizarov's readings or another conference, so many doctors come for collaborations, for presentations, and here doctor from Israel, from Germany, from Mexico, from Russia, from China. This is my office, and with Alexander Kirienko from Italy. This is outside of our institute, but center of our life. This is monument of Ilizarov. This is place where he sleep, and you can see Dr. Bari and Dr. Kirienko, Dr. Gubin. This is team from Mexico, 2 doctors who spent more than 6 months from India, Dorpeli, Sessa Marka, president, biggest association, patient association, short people in the world, ASAC from Italy. Here, I want to invite you just in our museum. You can see Ilizarov ask some secret from Hippocrates. And when you will hear, you need go in our museum, because there each piece remember hand of Ilizarov. Each page touch Ilizarov's hand. This is his old office, his old chair and old table, sofa, and you can see different variants. Our external fixator, some souvenirs from different countries. And museum is museum, and each time I'm 40 years work in Ilizarov Center, but each time I find in our museum something new. This is our building, model of our institute. Place where Ilizarov drink tea and talk with interesting person. Different external fixator of Ilizarov. On this old photo, Ilizarov near the Valery Brumel. Colleagues, remember, all of our life in the hand of patients. Brumel changed life of Ilizarov. After unsuccessful many surgeries in the Russia, more than 20, Ilizarov have pseudoarthrosis, shortening. This is our gold jumper, Olympic winner. He get gold medal in the Roma in Olympic Games. And when Ilizarov helped him, patients open Ilizarov name for the Russia, for the world. And you can see now out of my window more than 20 minus. And Ilizarov, when was young, sit in aeroplane without open aeroplane. Only imagine which how many degrees minus was outside. This is picture from seat and wood and nuts. Some patients make some souvenirs from his hand. This is from wood. I invite you in our center for conference for Ilizarov readings, when you will more than happy, because each chair, first chairs, remember spine of Ilizarov. Doctor from many countries. You know Dr. Klushin, he was in Bangladesh. This is lobby, company, show his products. During the conference, usually we have workshop, different companies, office of our director. Very sorry again of museum, I won't show, because during the Ilizarov's reading, all of visitors won't visit of museum. Very interesting library inside of swimming pool. I think this is one library in the world. Not only for surgeon and doctor, for patients too. Here, all of books on these streets, you can find many books from Dr. Bari. And Bari, your place I find here, on near with Ilizarov. But here must put your picture. Our garden, our library, and our winter garden, like gallery. Patient likes this place and spend each evening time, but before Corona, now impossible. And please, little bit check these trees. All of these trees has name. When somebody very important for us, WIP, Ilizarov surgeon died, we put on the earth some tree and give this tree his name. We have so many doctors who died and give names of this avenue of Ilizarov. Again, monument, Alea of Brumel. We have some monuments of our center. This is unique car of Ilizarov. Sometimes he drive. He was very dangerous driver. Without svetofor, without any rules. This is monument of patients from animal clinic, around of clinic and inside of our clinic. And I like this place because all time different. This is autumn, this is spring, this is winter. Operation theater, equipment of our operation theater. We have more than 20, near 30 tables, operations tables, so many operation theaters. And now, not so many Ilizarov surgeries, usually replacement of joints, nailing, spine surgery, but still some doctor use Ilizarov frame, including me. This is my father, my teacher, Professor Shevtsov. Another operation theater in clinic of animals, dogs, rats, tiger, eagle, owl, baby horse, cat, so many different animals our doctors help. On the left side, bear, baby dog. This is a different department of scientific research. And we have excellent educational department, with excellent teachers. I cannot without museum, sorry. Here we can see evolution, not only our fixator. For example, this is Counder's external fixator. This is Ilizarov fixator. Very strange, but this is story. And Ilizarov find on the way. And here, variant for treatment contracture of knee joint. Device for check of force of frame and wires. You need go there. And you will make so many photos. Because some doctors sit here, some doctors spend time in museum. And during the conference, we have interesting surgeries, show patient during the treatment, and patient with all types of orthopedics problems can be treated in the Ilizarov Center. We provide high technology medical care of the most complicated orthopedics conditions, including congenital and accurate malformations of limb, spine and spine cord, chronic osteomyelitis, deformity, arthritis, ankylosis, contracture of major joint, severe traumatic injuries of bone, joints and soft tissue, including gunshot trauma, orthopedic complications in systemic, neurological, endocrine disease, storage disease, and related pathology, complicated and complex sequelae of surgical treatment of orthopedics problems. Different patients during the treatment, foreign patients support and helped with documents and interpretations by an international department. And thank you, doctor, for your attention. And I want to invite you for this picture in front of our clinic. Dr. Bari select excellent team, and we will spend time not only in conference hall. We will go there, we will stay here, and I invite you to cooperation and exchange of our experience. Thank you very much, doctor, for your time.
Thank you very much, sir, for your nice presentation. That was a great virtual tour of Kurgan Center, that is the mother of Ilizarov Center. Hope we will be there in some day to see the Kurgan Center and join with Professor Novikov, sir, along with our legendary researcher, Professor Prof M Bari, sir, as a team leader, as before. I think it's a great presentation regarding the complications and definitely the Kurgan Center. As because of the time constraint, we have to finish our program here. And I would like to request Professor Novikov, sir, to say something only for regarding our program Orthopaedic Solution Academy, only for 30 seconds. Professor Novikov, sir, could you please say something?
I am very happy for your invitations. I am very appreciate, thank you, because we can share with our experience, and I believe some doctor just now has interest, and some doctor want to come here, and some doctor want continue to take some knowledge, because Ilizarov, this is not apparatus. Ilizarov, this is philosophy. Ilizarov, this is possibilities. This is Ilizarov, this is freedom. With this knowledge, with this experience, we can go away from any difficulties and we can prevent any complications. Thank you very much, and I hope we will meet again.
Thank you, sir. Thank you very much. Yes, we always appreciate, and we accept Ilizarov knowledge as a freedom, and definitely this is a philosophy. Now, I would like to request Professor M Bari sir to say something within 30 seconds, and by his speech, we will end up our program. Now, I would like to request Professor M Bari sir to say something.
For conducting a very good, interesting today, the complications that we are facing in our day-to-day life. And Professor Novikov showed a little bit of the center, very beautiful center. That's why I'm telling, once in a life, if you have time, you must visit the center. And our most of the orthopedic surgeons in 2011, they have visited 42 orthopedic surgeons. And so really, Ilizarov has given me a lot. Whenever I find Ilizarov in my hand, I can solve any kind of orthopedic and trauma problem, especially 85 to 90% of the orthopedic and trauma problem. Because this is a principle and philosophy. This is not the apparatus, not the putting wires only. So every orthopedic surgeon should have idea about the Ilizarov principle and methodology. Thank you so much for your kind attention and giving me the opportunity to talk in this forum. Okay.
Thank you very much. Thank you very much, sir. It's a great pleasure for us to have Professor Novikov sir and Professor M Bari sir with us, as because of both of them are a legendary Ilizarov surgeon and asset for our work. Dear viewers, I would like to thank Raj TV, as because of without the help of Raj TV, we cannot arrange this type of academic program, and definitely Renata Pharmaceuticals Limited for sponsoring our program. And I want to announce that in the next Friday, we will discuss about the radius ulna. That is a very important topic, and our speaker will be Professor M Bari sir. Till then, I would like to say bye-bye to all of you. Have a nice day. Have a safe day. Bye-bye.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe.